Hello, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. There's no doubt that burns are one of the most horrific injuries that doctors face, due to the effort it takes to treat them. Burns are tissue damage that happens due to overexposure of the skin to the sun, radiation, electricity, friction, and even chemicals. Thermal heat burns are when the cells of the skin are damaged by one of the following: hot liquids, hot solids, or flames. Burns can range from a minor medical problem to a life-threatening medical emergency. Burns represent a public health problem. According to the World Health Organization, an estimate of 18,000 deaths occur every year due to burns. The vast majority of them occur in the middle and low-income countries. They mainly occur at home or the workplace. Besides, non-fatal burn injuries are the leading cause of morbidity. The symptoms of burns vary based on how deep the skin is damaged. It can even take a day or two for symptoms to appear in severe burns. Burns are divided into three categories according to the symptoms and depth of injury. Our role today is to answer most of your questions regarding burn reconstruction. Today we have Dr. Kim, who is a leading doctor at Hanyang University Hospital in Seoul. He's going to discuss with us about burn reconstruction from an experienced medical point of view. What are the plastic surgery options for burn?
Burns can happen due to a variety of causes. Acute burns are severe, and unlike what we discussed before, we use skin graft tissue. Grafts are tissue that come in thin sheets and are often used for treatment of acute burns.
So, Dr. Kim, in your opinion, what is the best treatment between those?
Flap is superior in terms of look and feel of the original flesh. However, the downsides are limited locations where we can take flap. Time for the surgery is long and can be quite complicated. While the flap method is ideal in many ways, we cannot employ this method to all who have suffered burns. In such situations, grafts can be the best option due to its speed of deployment. So depending on the situation, one could be the better method. We must weigh the situation and choices to make the best balanced decision.
So talking about skin graft, is it possible to do skin graft right after a burn, or like you have to wait a little bit and then get the skin graft?
One must wait a bit. We must wait to know exactly how severe the burn is and which depth of tissues are affected. We call that a demarcation line. Once a demarcation line is established, we remove the dead tissue and do skin grafting when the outermost layer of the burn starts recovering. Typically, it can vary from 1 to 3 weeks, as we can know the depth of the burn severity precisely. Then when that is confirmed, we start the skin grafting.
Right. So this is a question asked by a lot of people about scars. For burn scars, is it possible to completely remove them?
Yes. Yes, if the affected area is not too big, we can remove the deep tissue and reconstruct it with a flap. But if the affected area is 50 or 70%, it is difficult as the source for flap is limited. So depending on the severity and coverage ratio of the affected area, will dictate whether we can recover the patient without leaving scars.
So how long does it take to heal completely after a burn reconstruction surgery?
Depends on which surgery. Skin graft surgeries take 2 to 3 weeks for recovery. The same is true for flap surgeries. If it gets very delayed, maybe 4 weeks. And those who recover fast are about 2 weeks.
Burn reconstruction, which is a branch of cosmetics surgery, can help a patient who has suffered trauma, an accident, or cancer to regain normalcy in many situations. There are two types of reconstruction in terms of tissue used. Flap is when tissue and its supporting capillary structure is taken from one part of the patient's body to another part for reconstruction. For breast reconstruction, flap tissue is taken from the belly area. For legs, tissue is taken from the thighs. The skin graft technique uses a thin layer of cultured cells but does not contain its own capillary system. Graft techniques are often used in reconstruction of limbs as a result of acute burns. Flap is superior in terms of look and feel of the original flesh. However, the downsides are limited locations where we can take flap. Time for the surgery is long, and it can be quite complicated. While the flap method is ideal in many ways, we cannot employ this method to all who have suffered from burns. In such situations, graft can be the best option due to its speed and deployment. So depending on the situation, one can be the better method. We must weigh the situation and choices to make the best balanced decision. Skin grafting is a relatively easy surgery, but in cases where there is lack of adhesion of the graft to the rest of the flesh, we are faced with a difficult situation whereby we must perform skin graft surgery again. Lack of adhesion is the biggest risk. How long does the surgery take? Depends a great deal on which surgeon does the construction. A flap reconstruction surgery generally lasts a good 6 to 8 hours, but here at the lower extremity reconstruction department, it is done in about 2.5 hours. Thank you for joining us in yet another video covering key health-related topics with Cloud Hospital TV. If you have any questions or comments, please leave it below and we'll respond to you as soon as possible.